So I guess when we think of what's ahead or on the horizon for 2012, and of course we're already here already in the new year, but I think it ends up being more of the same as it relates to quality and anesthesia. This year will in some ways be the last incentive year for quality as it's tied to the bottom line into dollars, especially as we look at programs such as PQRS, and that 2012 represents the last year of an incentive for reporting those measures. 2013 starts to be the carrot of sorts, where it's no longer an incentive to report on those critical measures, but actually it's a disincentive, I suppose, if you don't, because CMS will actually start taking money away from physicians and physician groups who are not reporting those. So that's certainly a key this year for anesthesia groups and other physician groups in general to really start paying attention to the CMS requirements and the physician quality reporting system. So the other big system, of course, is the new value-based purchasing system, which again for anesthesia is tied to some of the key critical skip core measures that are also reported through our hospitals and of course is then reported up through CMS. And those measures are also now tied to the bottom line for hospitals, as we know. This year is the what's called the performance year, and it actually began in July of 2011 and will actually run through March of 2012. And in that time frame, the measures, the skip core measures that are related to anesthesia that are reported by the hospital to CMS will actually count in fiscal year 2013 for the hospitals as for their adjustments for the claim measures, or the claims, I should say. So that's key for hospitals, of course, because that's their bottom line moving forward in as it relates to the CMS claims and the Medicare, Medicaid claims. So those are really the two probably big key ones, that are really tied to dollars and quality moving forward. But again, I would stress that I think this is an era of accountability and transparency for anesthesia. We just recently saw a study that was released by the OIG, Health and Human Services, where it talks about this complete underreporting of anesthesia, of outcomes and incidents for Medicare patients that's happening throughout the country. So although we always talk about quality and we'd like to believe that certainly we're improving it, the reality is, unfortunately, that it still seems that there's a disconnect in reporting those measures to CMS. So I think for anesthesia, there's definitely a need and certainly a value to be placed on transparency and accountability and kind of self-critique and reporting these any sorts of incidents or certainly looking at clinical outcomes on a regular basis. And I think, as we talk about quality again, I can't stress enough the need for what I call quantifiable quality. That quality can't just be kind of this amorphous of data that doesn't really get analyzed and doesn't get acted upon. So again, in anesthesia, I would certainly look to the skip core measures that anesthesia is responsible for. And I would also look at the World Health Organization surgical checklist, which has also been proven and has demonstrated success in reducing errors in the operating room and surgical safety and quality. So I think as we look at that, and interestingly enough, CMS has also, coming into 2012, recently published their requirements moving forward for ambulatory centers that beginning in fiscal year 2013, that ambulatory facilities are also going to have to implement the surgical checklist in order to receive the highest levels of reimbursement in their ambulatory facilities. So there's definitely an increased focus as it relates to anesthesia and quality, and certainly this is all tying to the bottom line of facilities. So, and I think third would probably be innovation and the need really for anesthesia to continue to innovate in every way, innovative leadership in leading these complex systems and processes and these requirements that are coming from our government and the accreditation agencies that are really pushing for quality. innovative systems and processes within our groups and how we manage our groups on a day-to-day basis, and the efficiencies and the productivity of our clinical staff. And then just the innovative analysis on the back end for the outcomes data, looking at differently this data and how we can really truly quantify high quality and safe care, looking at risk adjustment for outcomes data, looking at predictive modeling and high reliability studies to really take data and be able to, with a certain degree of predictability, be able to avoid the near misses or other sorts of incidents or adverse events that may happen. So I think really that's the challenges that lie ahead. They're certainly attainable, but it certainly is going to take some incredible leadership, some clinical leadership, and really the back end systems and resources to be able to support and achieve the success.